Today's topic is on fluoride. So the basic action of fluoride we need to know is that it can enhance remineralization and it can stop demineralization. So fluoride, even in very trace amounts, can increase the resistance of the tooth structure, or it can increase the resistance of the hydroxyapatite crystals for further crystallization and also for enhancing the remineralization, even in very trace amounts. It increases the resistance of the tooth, and it also reduces the risk for caries, and it is available in different forms. It can be in fluoridated water, then we have fluoride containing toothpaste, and in dietary measures all we can include fluoride in the proper ppm. Okay, so the optimal fluoride level for the public water supply is 0.7 milligram of fluoride per liter of water. So this value is important, that is 0.7 milligram of water. Okay, fluoridated water we need. And other two values we need to remember is 0.1 ppm and 10 ppm. It should not be less than 0.1 and it should not be more than 10 ppm in any of the other fluoride measures, like a dietary measure or a toothpaste or a varnish or whatever it is applied. It should be within this limit, 0.1 to 10 ppm. If it is 0.1, below 0.1, it is not effective. 0.1 and less than that, the preventive effect is lost, and it is about 10 ppm, there is a chance for fluorosis to occur. So these three values, 0.7 mg, 0.1 to 10 ppm. Okay, these three values we have to remember for fluoride. Then we have to know the mechanism of action of fluoride. So in detail we have to know about the effect on the bacteria that is present within the dental plaque. Then it has an effect on hydroxyapatite and it has an effect on enamel surface. So this I will be discussing in detail. This I will split into 2 points. That is, effect on the hydroxyapatite is that it can enhance the remineralization. Okay, it can enhance remineralization, and the other effect is that it can increase the crystallization of the hydroxyapatite. So these are the 2 points it has on the effects on fluoride, effects of fluoride on hydroxyapatite. And effects on the enamel surface is that this fluoride ions get absorbed onto the enamel surface. So what is its main action? It can resist the tooth from further decay. Resist tooth from further decay. Okay. So these are the effects on hydroxyapatite and effects on enamel surface. Now coming to the effect of the bacteria in the dental plaque. First is that it can inhibit the bacterial growth and metabolism, and it can also inhibit demineralization. How does it inhibit the bacterial growth? And we have to know in this, the specific enzyme is there, that is the specific enzyme name is enolase. This fluoride can inhibit this enzyme enolase, and it can disrupt the carbohydrate metabolism. That is, we have already mentioned, for demineralization to occur, if there is a refined carbohydrate, the bacterial invasion, it can convert it into lactic acid, which can cause decay of the tooth. So once this enzyme is inhibited, that is the enolase enzyme, it can disrupt the carbohydrate metabolism and can exert an anti-caries activity. It can exert an anti-caries. So first it inhibits the bacterial growth and metabolism. Later it inhibits the demineralization. The demineralization is that how does it convert? It converts glucose into lactic acid or any other acid like butyric acid, etc., or propionic acid also in small amounts. But main acid is lactic acid. The two other minor acids that is produced is the butyric acid and the propionic acid. So it is the lactic acid which causes demineralization of the tooth. So it can inhibit the demineralization by disrupting this carbohydrate metabolism. So first is the enolase enzyme is inhibited, then carbohydrate metabolism is also inhibited. Okay, so these 2 points we have to remember. That is for the effect of fluoride on bacteria. Then we have effect of fluoride on hydroxyapatite. The 2 points are it increases or enhances remineralization, and it also improves the crystallization of the hydroxyapatite. And the effect on enamel surface is that first the fluorides gets absorbed onto the surface of the enamel, and it can cause remineralization, or it can cause the tooth to withstand the acid attack. It can increase the resistance of the tooth to any sort of acid attack. So that is about the effect of fluoride on bacteria, on hydroxyapatite, and on the enamel surface. Then we have the application. How is it applied? We have topical fluoride. So what do you mean by topical fluoride? It is the delivery systems for a local chemical reaction to the exposed surface of the erupted tooth. Okay. When we apply it locally to that specific area, we can say it onto the local external surface. If we are applying it, we can tell the application of the fluoride as a topical application. So this can be brought about by two methods. One is the professionally applied technique, and also the self-applied fluoride. Self-applied can be in the form of toothpaste, etc. So the professional application can be the APF, stannous fluoride, and the sodium fluoride, that is the NAF 2%. Then we have stannous fluoride 8%, and we have 1.23% acidylated phosphate fluoride APF. Okay. Then we have administered fluoride in cases like mouth rinses and also dentrifices. So we have a small table regarding the method of application of different types of fluoride, that we have different techniques also. So there is the first, the patient has to undergo a thorough oral prophylaxis, and the quadrant has to be isolated before going on with the application. So the Knudsen technique is for 2% sodium fluoride. Then for Muller's technique is for 8% stannous fluoride, and Brudival's technique is for 1.23% APF gel. Either it can be gel or it can be a liquid. So Knudsen technique, that is the 2% sodium fluoride. Each tooth can be wetted with fluoride for 3 to 4 minutes. The first step is common for all the three. That is the fluoride, whatever concentration. If it is a 2% sodium fluoride, it can be 8% stannous fluoride, it can be 1.23% APF. The first step is common, that is the tooth should be wetted for the prepared agent of fluoride application for 3 to 4 minutes. Okay, 3 to 4 minutes. Then the next technique is the next procedure for sodium fluoride, 2% sodium fluoride, that is the patient is done, it is done 3 times in the same week, 3 times in the same week. Other one, every 30 seconds it is reapplied, and once a year recommendation. And here the floss is impregnated so that there is more penetration, and also it is passed interdentally. It is recommended semi-annually. So here we have to remember that it is for 3 times. Okay, 3 times. Then for 30 seconds in this Muller's technique, that is the 8% stannous fluoride, and for 1.23% APF or the acidylated phosphate fluoride, that is the Brudival's technique, semi-annual application is done. So to conclude, so the dental caries, it is the dental caries is it is a multifactorial disease with bacteria, and if the host factors are also favorable, by like the quantity of the saliva is decreased or the quality of the saliva is viscous, it can enhance the progression of the dental caries. So it is a multifactorial disease which can present with a wide range of clinical features. So understanding each and every clinical features, the diagnosis, and also the proper management by application of fluoride is very important to prevent the further progression of the dental caries. Thank you.